Bonjour, je m'appelle Kathleen Morris et je suis votre modératrice aujourd'hui. Je suis vice-présidente de la recherche de l'analyse à l'ICIS, l'Institut canadien d'information sur la santé, et membre du conseil d'administration du réseau canadien des centres de données de recherche. Il me fait plaisir, au nom de RCCDR, de souhaiter la bienvenue à tous nos participants canadiens et internationaux. Nous sommes très heureux que vous soyez des nôtres pour cette conférence virtuelle du RCCDR présentée en partenariat avec Statistique Canada. This week's series addresses cross-cutting research and policy priorities, and today's spotlight is on gender issues. I'm very pleased to welcome 4 panelists who will share their experiences of how CRDCN is advancing their research and informing policy as it relates to gender issues. They will discuss the role of CRDCN and of Statistics Canada data in enabling policy-related analysis on key cultural, socio-economic, and health issues in the pursuit of a just, equitable, and inclusive Canada. They will also share their aspirations for future data, research, and policy development. Each of our panelists will present remarks of about 6 to 7 minutes. As this portion of the panel has been pre-recorded, we invite you to submit your questions as you listen to each speaker. We will get to as many of them as possible in the live Q&A that will follow. It is now my pleasure to invite Sylvia Fuller, professor in the Department of Sociology at the University of British Columbia, academic director of the British Columbia Inter-University Research Data Center Network, and CRDCN board member, to kick off today's panel. Sylvia's work focuses on understanding how entrenched patterns of inequality in the labor market develop and erode, and in the implications of changing employment relations for workers' prospects for security and mobility. Over to you, Sylvia.
We've been asked today to speak about how accessing RDC data has impacted our own research on gender. Now, I've been working in the RDC for about 15 years now, so I've done quite a lot of projects in that time, but I thought I would just share with you a couple of insights from my more recent project that was examining gendered parenting pay gaps using data from the Workplace and Employee Survey. So this is a linked survey where we can follow individuals and the organizations in which they are employed. And so what I'm going to share with you today, a few of my findings from that research, these are insights that were only possible because of that linkage that was enabled by the now sadly defunct WES. Because I was working with data that tied individual workers to their employers, I was able to look at whether or not these family pay gaps, and here I'm going to talk about the gap between mothers and childless women, were happening because mothers were being paid less within particular organizations or because they tended to be working for organizations that paid everybody worse. So a feature of how mothers and childless women were segregated or sorted across workplaces. And what I found was that the vast majority of the 3% wage differential against mothers was happening because they were working in different establishments. So net of all the individual characteristics of workers in those establishments that tend to influence pays, we found that workers were working in establishments that tended to pay everybody worse, and that this was what was really driving the motherhood pay gap. Here we see this with the dark bar that is showing the portion of that pay gap that is tied to sorting, and the lighter blue bar is showing the non-significant portion that is tied to within organization pay differentials. So one question that arose then was, well, are mothers working in poorer paying establishments because they're trading off better or more family-friendly working characteristics for lower wages? So things like access to part-time work, not having to work overtime, top-ups or parental leave, assistance with child care, flexible hours, being able to work from home, those kinds of things. So when I added those into the model and I controlled and accounted for those, we did see that that sorting penalty does diminish. This is the right-hand side of the figure here, where we see there's family supportive controls. But most of it remains unexplained. So it goes down by about a third, but it's still not accounting for the penalty. So the next thing I looked at was whether or not characteristics of organizations that we know tend to reduce the possibility or the opportunity for discrimination had an impact on that penalty. So was it that, maybe if it was harder to discriminate against mothers, we would see less of that penalty of mothers being sorted into those poorer paying organizations. And in fact, this is what we see to be the case. So when we look at the for-profit sector versus the not-for-profit sector, which includes sort of the broader public sector in this data set, we see a much smaller motherhood pay gap, and in fact, it's diminished entirely in some cases when you are in the not-for-profit sector. So this is the bar with the hash line versus the solid blue bar. And here the two different comparisons are for mothers who have changed employers after a period of time out of the labor force to care for their kids or others, or some other change of employers. Because what I also found was that pay penalty was really tied to mothers who were changing employers after they had kids. Women who were staying with the same employer didn't have that penalty. We also see a much smaller pay gap among unionized organizations. Again, this is the hash here versus the solid bar. And among organizations where there is a formalized HR department, which again tends to reduce opportunities for discrimination on the basis of family status, which is prohibited in Canada in almost all jurisdictions at the time of the survey. So we see that the organizational characteristics really matter for motherhood pay gaps. The West also has really rich data on other kinds of job characteristics, such as the flexibility of jobs. And so we also, in another paper, looked at whether or not this impacted the pay gap. And here again, we see that these job characteristics matter. So this is just a simple graph that's showing all mothers. In the paper itself, we look across educational groups and see that there's variation there as well. But we see that this pay gap is larger in the blue bars, where we have among workers who have rigid work hours than it is among those who have flexible work hours. And it's also larger among workers on average who are among women, I should say, on average, who are not able to work from home versus those who are being paid to have some hours working at home versus the workplace, and also among those who are putting in some extra hours at home in addition to what they have in the workplace. So again, those characteristics of the work really matter for the motherhood penalty. So what are some of the implications of this research? Well, first of all, parenting pay gaps aren't necessarily all that unique. So some of these generic organizational factors that tend to create more and less scope for bias to operate matter for motherhood penalties and also for fatherhood premiums, but that's another story. And this is somewhat positive because it tells us that that really slow and challenging process of changing broader societal norms around gender and caregiving isn't the only avenue for improving the disadvantage or ameliorating the disadvantage that mothers face in the labor force. And it also suggests that creating more opportunities for flexible work in organizations can be potentially useful, not just for personal well-being, but also for addressing some larger impact. So that's a little snippet of my research. Of course, I am only one scholar among many who have been using the RDC to understand gender inequalities in the labor market and in the work-family intersection particularly. I think a lot of the really exciting work coming out these days has been taking advantage of administrative data linked to survey data, such as Rachel Margolis's work on parental leave. And I think that that's certainly an important area for future research as policies are changing in the wake of the pandemic. And I would say when I think about looking ahead, what is going to be really important, it is going to be looking at how COVID is impacting the reorganization of work and labor markets and how that matters for gender inequalities. We need better information on what's happening in labor markets to mothers and fathers in particular, as work and care has really been disrupted and has led to a lot of changes in how work is getting done or not getting done, both at home and in the labor market. So in this respect as well, I'd like to say that we have a bit of a data gap with the loss of good organizational data like we had with the Workplace and Employee Survey. There hasn't been a real replacement for that. And as governments change their policies, but also workplaces change their policies and their ways of working, understanding what the implication of that is for gender inequality is going to be a really important area that we do need to understand as we go forward. So I hope Statistics Canada listens to this and might think about how we might bring in some of that rich organizational data again to better understand what's happening with gender inequality in the pandemic.
Thank you, Sylvia, for your remarks. Connecting the issue of motherhood wage gaps and gender issues has really been very helpful to our broader discussion. Our next speaker is Neeru Gupta, Associate Professor in the Department of Sociology at the University of New Brunswick in Fredericton. Her interests lie in research design and metrics using a gender and social equity lens to help inform the healthcare quadruple aim: healthy populations, sustainable healthcare investments, and better patient and provider experience. Neeru, over to you.
Merci beaucoup. Alors, la plupart de mes recherches se reposent sur l'analyse des données administratives et à base populationnelle désagrégées selon le sexe pour appuyer la prise de décision en matière du quadruple objectif pour améliorer la qualité des soins de santé pour une optique d'égalité des genres au Canada. Qu'est-ce qu'on veut dire par le quadruple objectif? Alors, c'est un cadre conceptuel pour évaluer comment est-ce qu'on devrait améliorer la qualité des soins de santé, initialement développé par le Institute for Healthcare Quality Improvement. Il s'agit de 4 objectifs. Améliorer les expériences de soins pour les patientes et les patients, améliorer la santé de la population et s'assurer que les investissements dans les systèmes et les services de santé soient faits d'une façon durable. De plus, dans les dernières années, on reconnaît de plus en plus l'importance de bonifier l'expérience de la vie professionnelle des prestataires de soins de santé comme un prérequis pour l'amélioration des 3 autres objectifs. En particulier, mes études se reposent sur une vue d'égalité entre les sexes et les genres dans l'obtention de ces 4 objectifs. Qu'est-ce qu'on entend par le sexe et le genre? Le sexe en particulier, on pense aux différences biologiques. Le sexe étant une détermination médicale à la naissance. Par contre, on définit le genre comme une construction socioculturelle qui définit les attentes, les normes des hommes et des femmes et qui varie selon les sociétés et dans le temps. Est-ce qu'on a vraiment besoin de parler de sexe et de genre? Les politiques, les attentions médiatiques diraient que oui. Mais en réalité, on trouve que ces différences sont souvent oubliées en recherche. Donc, par exemple, récemment, je vous donne 2 exemples de revues systématiques de la recherche en santé. En particulier, Petkovic, il y a seulement 2 ans, on fait une analyse de plus que 600 revues systématiques et ils ont démontré que moins de 30% ont fait état du sexe et du genre dans les résultats. Plus récemment, avec une étudiante à l'Université du Nouveau-Brunswick, nous avons fait une évaluation d'une 40aine d'évaluations d'une politique de financement connue comme la rémunération au rendement pour les médecins généralistes dans différents pays. Aucune de ces évaluations ont parlé du sexe des patients comme un objectif de l'évaluation de l'impact de cette politique. Aucun n'a parlé de la vie professionnelle des prestataires de santé, par exemple en matière d'équité salariale. Alors, le fait de ne pas parler du sexe et du genre dans la recherche en santé a potentiellement des conséquences inattendues qui puissent exacerber les inégalités qui existent déjà. So much of my research focuses on the collection of particularly increased optimal use of sex and gender data from existing national and provincial sources to advance health and social policy relevant research. Some examples of this research include examining sex disaggregated data framed through a gender-based analysis framework in looking at what are some of the predictors, for example, of health outcomes amongst people with chronic diseases. In one recent example, using linked population census data to hospital discharge administrative data, we found that the measure of socioeconomic status was different among women and men in terms of their impact on the risk of a diabetes rehospitalization. Among men, income was a greater predictor. Among women, it was education. So the implications of such kinds of analyses that use sex disaggregated data imply that poverty reduction strategies to reduce disparities in health outcomes, which fail to take into account gender differences, may in fact contribute to gender gaps in health outcomes. Another example, using provincial administrative data in collaboration with colleagues at the New Brunswick Department of Health, looked at pay-for-performance financing options among family physicians for diabetes care. And looking at this through a gender lens by using sex disaggregated data, we found that while the coverage of pay-for-performance maybe didn't differentiate by the sex of the patient, a significant and increasing trend over time of male overrepresentation in pay-for-performance uptake compared to women may lead to exacerbated gender inequities among the provider workforce in terms of increased gender pay gaps. So the implications are that health financing decisions, which tend to be gender blind, may unintentionally contribute to gender-based inequities if they do not take into account the use of sex disaggregated data in the planning, implementation, monitoring, and evaluation of related policies. So where do we go from here? There are many strengths and limitations to each type of data source that we can use to advance our understanding of what's working and what's not working to improve healthcare across Canada. On the one hand, we have the population census, which offers advantages in terms of having a very large sample size that allows us to investigate what can be statistically considered relatively rare events, such as a diabetes rehospitalization. And as a researcher looking at gender and social equity issues, I'm particularly looking forward to the 2021 census results, which will include for the first time questions on sex at birth and gender identity to allow us to better gauge impacts of sexual minority status on differences in health outcomes. Over time, the Canadian Community Health Survey, for example, has been expanding its data collection on sexual identity and sexual behavior, which will allow for increasing opportunities to conduct research not just on gender, but on identity characteristics that intersect with gender. And the more linked population-based and administrative data that we have, the more opportunities that we have for health research. And the more that we can link these to different kinds of administrative data sets over time, the better we can track impacts over time of different social policies among population cohorts with little loss to follow. It's an exciting time to be a health researcher.
Thanks, Niru, for showcasing how you've been able to advance your research and inform key healthcare questions like pay for performance using a sex and sexual identity lens and the CRDCN linked data. We will now hear from Dion Poehler, Acting Director and PhD Coordinator at the Centre for Industrial Relations and Human Resources at the University of Toronto, where she holds the CIBC Chair in Youth Employment. Dion is also cross-appointed to the Rotman School of Management and a research fellow in cooperative strategy and governance with the Center for the Study of Cooperatives at the University of Saskatchewan. Over to you, Dion.
Thank you, Kathleen. So most of the focus of my research in the past few years has been on equity and inclusion in Canada, with a particular focus on the sources of advantage and disadvantage in the labor market and across communities, and also on policies that might be more or less effective in addressing the key drivers of disadvantage. My focus has mostly been on geography and class as drivers of inequity and exclusion. So for instance, exploring challenges faced in rural and remote settler and Indigenous communities in Western Canada, and the impact of different policies on low-income workers, including now exploring some of the effects of COVID and COVID-related policies on these groups. And so, full disclosure, in many ways, I feel like I'm an odd person to have on the panel spotlighting gender issues, because gender is a relatively new area of research for me. And that really, until more recently, I'd never even considered gender a major driver of advantage or disadvantage, probably because since we're all shaped by our own unique backgrounds, personal experiences, and frames of reference, in my case, I actually think I always felt that gender was a major advantage for me. Because the fact that I knew I couldn't become a Catholic priest or take over my family farm from a very early age because of my gender meant that I was much less constrained by my family's expectations and more free to explore other opportunities like becoming an academic, which I think I'm much more suited for. However, more seriously, since coming to the University of Toronto, I've been learning a lot from many exceptional doctoral students, postdocs, and faculty members associated with the Rotman Institute for Gender and the Economy. And they have taught me a lot about the important role that gender plays in structuring advantage and disadvantage. And I've started to include gender, or at least sex, as a variable I actually think about conceptually and empirically explore in my projects, rather than simply including it as a control variable in other analyses on the right-hand side of regression. So, for instance, in a current and ongoing RDC project with my doctoral student, Courtney Cable, we used the longitudinal administrative data bank and the survey of labor and income dynamics to explore the labor supply effects of the working income tax benefit on single individuals with and without children. And we also explored differences across women and men. And this research has really directly informed a recent policy proposal we developed and published in Canadian Public Policy in September 2019 on expanding the Canada Workers Benefit to design a guaranteed basic income. And this is a policy that I'm sure, as many of you are aware, is garnering lots of debate currently in the media and among academics. In my personal view, one interesting research area on gender, and where I think there's still a lot of work to be done, and I know Sylvia Fuller, who opened this panel, is doing a lot of great work in this area, surrounds the labor market transitions men and women make to accommodate children. One project I'm working on in this area is with Michael Baker, Sarah Kaplan, April Franco, and Shannon Potter. We just received approval to link the Canadian Employer-Employee Dynamics database with the Workplace and Employment Survey to directly observe where women and men are employed prior to having children and where they move after a birth of a first child. And in particular, what specific human resource policies and practices exist in those firms they move to and from. So the ability to link tax and family data with detailed employer data on human resource practices is really critical, in my opinion, to really tease out the mechanisms that lead to findings that gender earnings gaps widen for women after the birth of a first child. This type of analyses will also help determine if total gender compensation gaps are higher or possibly even lower than reported gender pay or earnings gaps. However, there are some problems with this data and approach. The Workplace and Employment Survey, as many of you know, is now dated. It was discontinued in 2006, and there's no good replacement for it to date. I'm actually working on another project exploring the impact of COVID on businesses in Canada, and there really isn't much longitudinal or detailed survey data collected from businesses using more random approaches to sampling. One other major challenge we've had with this project on the motherhood penalty has actually been accessing the data. And now that it's approved, we're even more concerned about that. Because this type of linked data is not yet available in the research data centers, we had to apply through the Canadian Centre for Data Development and Economic Research and need to be able to travel to Ottawa to access this data, which poses problems for most of the members on our team. These access problems have only been worsened by the onset of the pandemic. So I personally am eagerly awaiting the day when RDC researchers can access more linked data within the RDCs or even better yet, remotely. And I know I'm not the first person to have noted this during the conference. So I've learned a lot in working with these projects, both within and outside the RDC, with people who have far more expertise on gender than I do. And it's really wonderful that there's been such an increased attention and focus on research and policy around gender, particularly during COVID. I've really noticed a lot of it. However, in focusing increased attention on gender, back to sort of some of my other areas of research, I think that we can't forget that geography and class and race, in particular Indigenous identity, matter a lot. And I know that the CRDCN has panels on many of these different kinds of classifications and identity markers. So maybe my sort of proposal for thinking about future research, maybe it's a call for a more intersectional approach to understanding the way we study gender. But on some issues, it actually might even mean that the predictive power of some of these other variables on outcomes and as a result, their policy relevance might even eclipse gender. So I think that COVID is going to encourage us to completely rethink conventional classifications that we use as academics. For instance, on class, I've suggested in other writings that physical distancing rules and business closures imposed by governments have generated 3 new classes of workers. Those individuals who have lost their jobs, who've had their work hours fully reduced, those who are able to continue working mostly or exclusively from home, and those who continue to work mostly or exclusively outside the home. And I actually don't think it's yet at all clear what kinds of workers are more or less represented in each group. I think there's still a lot of work that needs to be done in this area. And I don't think we yet have a lot of a good understanding. And I think this will come out in future studies and research that's done in the RDCs on how being in a particular group, race, gender, class, will shape sources of advantage and disadvantage around gender in the future, given these emerging classes of workers during the pandemic. So to conclude, I think it's a really interesting time to be studying issues around inequality in general and gender in particular, looking at what the different drivers of inequality are, including gender and beyond, and what it means for outcomes for different groups. And the opportunities for linking Statistics Canada data sets and accessing them in the RDC provides so much potential for exploring these issues. I'm incredibly grateful for all of the work of the people within Statistics Canada, CEDAR, and also the CRDCN for continuing to facilitate these wonderful opportunities. Thank you. Back to you, Kathleen.
Thank you, Dion, for your presentation. Your research findings have really opened our eyes to the potential of incorporating sex or gender roles into existing research programs like yours on labor markets and employment programs. And I think it's also raised some thought-provoking ideas on the many changes that COVID will prompt in the research work that we all do. Maintenant, il me fait plaisir d'inviter Monsieur Marc Lachance à vous adresser. Marc est le directeur des statistiques socioculturelles et de la diversité et directeur général par intérim de la division Justice, Diversité et Population à Statistiques Canada. Marc supervise plusieurs programmes statistiques liés à l'immigration, à la diversité ethnoculturelle et linguistique, au peuple autochtone, à l'analyse comparative entre les sexes, au handicap et aux questions sociales en général. Marc, à vous la parole.
Merci beaucoup, Kathleen. Alors, ça me fait grand plaisir d'être parmi vous aujourd'hui. Je vais limiter mes remarques aujourd'hui pour pouvoir vous rapporter des faits saillants de Statistiques Canada dans le passé récemment, mais aussi en ce moment et aussi dans le futur pour pouvoir faire avancer les connaissances sur la recherche et les données qui peuvent supporter l'analyse sur les sexes. En particulier, si on va à la prochaine étape, à la deuxième étape, merci. Un élément catalysateur qui a été depuis 2015, c'est que le gouvernement fédéral a mis un accent un peu plus fort sur qu'est-ce qu'on appelle l'analyse comparative entre les sexes, qui est un outil politique qui permet aux décideurs politiques et aux chercheurs de faire avancer davantage toute une analyse axée sur les sexes et l'intersectionnalité. On a parlé dans des présentations précédentes l'importance de l'intersectionnalité des sexes. En 2018, le gouvernement fédéral a créé pour Statistique Canada le Centre des statistiques sur le genre, de la diversité et de l'inclusion. Je note ce fait-là important parce que depuis 2018, Statistique Canada a permis de faire avancer davantage les connaissances sur les sexes en faisant état, par exemple, en créant un carrefour de données qui permet aux chercheurs, aux utilisateurs d'avoir un accès plus rapide et plus facile sur la disponibilité des données de Statistique Canada par rapport au genre ou aussi à l'intersection. Récemment, le Carrefour a été mis à jour pour pouvoir refléter des analyses qui ont un impact direct sur certaines populations vulnérables, par exemple sur les femmes et sur l'intersectionnalité de certaines de ces variables-là par rapport à COVID. Un fait important du centre et que je voudrais souligner aujourd'hui, c'est que le centre a donné comme mandat aussi de produire de nouveaux renseignements en voulant combler certaines lacunes. J'aimerais peut-être souligner par exemple, l'année passée, nous avons diffusé un rapport méthodologique qui offre aux utilisateurs, aux chercheurs, de nouvelles méthodes pour pouvoir mesurer l'écart de rémunération salariale ou rémunération sur les salaires. On a déjà noté dans une présentation précédente l'importance de mesurer ces écarts-là. Alors, à travers le Centre de statistique du genre et de la diversité et de l'inclusion, nous avons offert des nouvelles méthodes qui permettent aux utilisateurs de choisir une méthode qui est peut-être plus appropriée à leurs études. Un fait important, puis ça a déjà été souligné par une des présentations à la prochaine étape, que le centre a travaillé depuis un certain temps. On a mentionné souvent, on fait référence au sexe, on fait référence au genre, et une des présentations que vous avez entendues il y a quelques minutes, on a mentionné l'analyse entre les sexes ou entre les genres. Alors, Statistique Canada s'est penché sur cette question-là depuis 2016. Comme vous le savez, traditionnellement, Statistique Canada mesure le sexe sans vraiment préciser qu'est-ce qu'on voulait dire par le sexe. Était mesuré de façon binaire, masculin ou féminin. Pour pouvoir refléter mieux la diversité de l'identité sexuelle des Canadiens, nous avons développé des analyses, mais aussi des nouvelles méthodes pour pouvoir essayer de voir comment qu'on pourrait introduire le concept du genre dans nos statistiques, dans nos outils statistiques ainsi que dans nos nouvelles collectes de données. Alors, tout ça, ça nous a fait amener à créer de nouvelles normes, mais aussi de nouvelles variables sur le genre, et aussi, nous avons conservé aussi la variable sexe, mais nous avons clarifié le sexe comme étant le sexe qui était assigné à la naissance. La raison que je le mentionne aujourd'hui, c'est très important parce que depuis 2 ans, Statistique Canada mesure maintenant, a transformé ses outils de collecte de données pour pouvoir mesurer le genre, en particulier comme défaut. Et nous avons aussi conservé le sexe à la naissance pour certaines enquêtes où ce que la taille d'échantillon nous permettrait d'avoir les deux. Et ça, c'est important pour la recherche dans le futur parce que ça veut dire qu'à partir dès maintenant, les nouvelles enquêtes qui ont été mises en place à Statistique Canada depuis 1 an ou 2 ans, les chercheurs auront maintenant avoir accès au genre. Il n'y aura pas, on n'en s'entend pas de différence marquée entre le genre et le sexe. Sauf que qu'est-ce que ça permet d'offrir aux chercheurs, c'est que maintenant, ils vont pouvoir avoir accès à une 3e catégorie, qui est les personnes de genre divers, qu'est-ce qu'on appelle les personnes non binaires dans cette catégorie-là, qui n'étaient pas mesurées dans le passé. Et si on regarde maintenant aussi les nouvelles initiatives à Statistique Canada de cet acetate, c'est qu'on a déjà mentionné que Statistique Canada a répondu très rapidement à la pandémie en mettant en place des nouvelles méthodes de collecte que ce soit des panels web ou bien ce qu'on appelle en anglais des crowdsourcing, en français l'approche participative. La raison que je mentionne ces nouvelles méthodes-là, c'est parce que les chercheurs pourront avoir accès aux utilisateurs à une panoplie de nouvelles enquêtes qui ont eu lieu dans les dernières semaines qui leur permettra d'avoir une meilleure perspective de l'impact que COVID pourrait avoir ou a sur les sexes et les genres, et aussi d'une perspective d'intersectionnalité. En particulier, la dernière approche participative de la discrimination, nous avons mis en place toute une série de nouvelles, une série de variables qui nous permet d'aller chercher toute l'intersectionnalité sur le genre. Alors, on va aller chercher des questions sur les populations LGBT, les réfugiés, les immigrants et d'autres aussi identités. Fait marquant aussi, je voudrais souligner, c'est que depuis le mois de juillet, CRDC Canada recueille des données sur l'EPA en allant chercher une nouvelle variable sur les groupes de population. Je vais mentionner aujourd'hui parce que ça veut dire que depuis le mois d'août et la diffusion du mois de septembre et ainsi de suite, nous avons maintenant à la disposition de chercheurs une nouvelle variable sur la population, le groupe de population. Qu'est-ce que ça implique par rapport à une analyse axée sur les sexes? C'est que l'EPA permettra de faire de l'analyse un peu plus désagrégée sur certaines populations, surtout groupes vulnérables, comme sur les femmes de la population noire en particulier. Alors, les chercheurs auront accès à des nouvelles données à partir de l'EPA. On a déjà mentionné à travers une des présentations précédentes que le recensement de 2021 amènera de nouvelles variables. Comme vous le savez, nous allons avoir une nouvelle variable sur le genre et sur le sexe à la naissance. En ayant les deux, nous pourrons aussi avoir à chercher de l'information plus détaillée sur la population transgenre. Mais aussi, le recensement de 2021 amènera d'autres variables qui permettra l'intersectionnalité pour faire l'analyse comparative entre les sexes. Par exemple, nous aurons un indicateur sur les vétérans, nous aurons de l'information supplémentaire sur les métiers et ainsi que sur les élevés. Et aussi, finalement, je voudrais juste souligner qu'en ce moment, nous avons remis sur place une nouvelle collecte de données, une enquête générale sociale pour les groupes ethnoculturels. Nous avons été privilégiés d'avoir un financement supplémentaire pour avoir un suréchantillon pour cette population-là, qui permettra davantage de faire de l'analyse axée sur les sexes et l'intersectionnalité sur ces groupes-là. Alors sur ça, Kathleen, je vais terminer et je vous remercie énormément.
Un grand merci, Marc. Je sais que les chercheurs et les décideurs politiques sont les deux intéressés par les données de sacralité, comme le sexe et le genre. Et nous suivrons votre progrès avec un grand intérêt. This concludes the pre-recorded portion of the Spotlight on Gender Issues. We invite you to please stand by as we transition to the live Q&A session with our panelists. If you have yet to do so, please submit your questions. The live question and answer part is starting now. Hello, everyone, and welcome to the question and answer portion of today's session. We've got some great questions already coming in, and I encourage you to keep sending them. Sylvia, maybe we'll just start with you, if that's all right. And I'll let others chime in if they'd like to. So first of all, the questioner provided a comment about some of the great work that you're doing on the motherhood pay gap, and was wondering about whether one way of thinking about this is around insiders and outsiders in the labor market, where those on the inside have good jobs, good pay, good job security, and those on the outside have insecure appointment, poor pay, and work conditions. So the question is really about whether your findings are consistent with the idea that women, after they have kids, go from being insiders with good jobs to outsiders with bad jobs. And the question goes on to ask about whether that might be a different story than the bias one, and that there may be some employers, for example, who aren't discriminatory. It's just everyone has equally crummy work conditions. So Sylvia, I'll turn it over to you to kick us off on that one, if I could.
I think that's an interesting framing. I'm not sure I would say that it means that there isn't bias operating on the part of employers. It's a question of where the bias is operating, right? So what we're seeing in the data, and this is data that also relates to the premium that fathers earn, it tends to also reduce that premium, is where there's less opportunity for bias, you have less of that sorting into sort of better and worse organizations on the basis of family status. So in the case of mothers being sorted disproportionately into organizations that pay everybody a little bit less. So I'm not sure I would say it's just about being an insider or an outsider. There's something going on there in the sense that there seems to be less of a disadvantage within organizations, but I'm not sure that that's about what we would think of as a dualistic labor market per se. It's more about where there's, I think, greater information about mothers and perhaps as a result, less concern or less worry about their ability, their capabilities, their commitment to the labor market, where at the point of hire, you tend to have more ambiguity about that. And that's where there's more free reign for bias to come in and stereotyping against mothers to come in, and also where there's more opportunities for that to happen. So it is true that we tend to see less of this happening for more advantaged mothers where there's higher levels of education. So that does speak a little bit to that inside and outside. But we also see it as stronger for women who have some post-secondary education versus less educated mothers. So it's not just about a divide between, all mothers being sort of outsiders in these sort of really poor employment contexts, more precarious employment contexts. It's also about who, even within a sort of a given realm, are you having disproportionate sorting in that context? And that, I think, is still something that is more consistent with a bias story in terms of who gets sorted into those different places in the first place.
Thanks, Sylvia. Does anyone else want to weigh in on this? No, I think everyone thinks that Sylvia gave a pretty full answer. So let's move on to the next question. Mark, maybe I'll get you to take the lead on this one, but certainly anyone else can weigh in. The question talks about the lack of social sector administrative data outside of the health domain. And how do we encourage government departments interacting with social sector organizations to release more administrative data? What do you think, Mark?
So this is a very good question. So in fact, as you probably have noticed specifically from the pandemic, there's been a call for more data in order to measure on a more timely fashions the impact that COVID may have on gender and some intergenerational analysis. In fact, I can only agree more. Administrative data allows us to have access to more timely information. In fact, just recently, Statistics Canada in the justice sector, we've been able to put in place some new data collection, administrative data collections with police forces that would allow us to get better information on some specific subpopulations that allowed us to get access to this time information. So StatsCan is continuing this efforts with federal departments. We are working very closely with other departments and trying to see how we can accelerate. We know that there are some benefit programs such as the CERB. StatsCan is working actively with some of this the department to have access. Once we have access to this administrative data, as you know, we do have the ability at StatsCan to link or to integrate this information with other information that will allow us to get a bit more disaggregated data in order to make this data set more useful to researchers. So this is a very good questions. And I can tell you that StatsCan is working very hard to try to accelerate the access to this information by working closely with our partners.
Yeah. So Mark, thanks so much for that. So that's one way that we're seeing better access to administrative data. Any idea from the researchers or on the panel about things that they think could be helpful? Dion?
Well, I could give a bit of a, actually, because in the pre-taped comments, since then, there's actually been some developments on this front in terms of access for our project with CEDAR. We're likely going to be able to move it into the RDC at the University of Toronto, which has been huge in terms of facilitating access to the linked administrative data for us. And so I would echo what Mark has said, which is I think Stats Canada has been putting a lot of effort towards this access question. And just to reiterate that they are really doing a lot of new stuff and new work in that area right now.
Okay, does anyone else want to get in on that question? Oh, okay, well, let's move on then. And maybe Dion, I'll let you continue. Maybe taking the first crack at the next question, and I'll ask Niru to follow you if that's possible. And the question is, how do the speakers compare the need to focus on gender issues versus intersectionality of various other key factors? And those might be gender and race, gender and immigration status, ethnicity. And it's just a question about how does a user of the data kind of know which approach to use in terms of the comparative analytic potential? So Dion, if you could kick off, and then I'll just ask Niru to follow you.
So I think that's really probably the deepest question that can be asked about doing social science research in this area is sort of what are the primary kind of categorizations or classifications to look at. And I think to some extent, theory should really drive what we kind of expect to be finding across these different kinds of classifications. And I think that's sort of the first step, is that it should be driven by sort of theory around why we think different kinds of classifications of people would impact their outcomes, or some kind of policy or event like COVID would impact their outcomes differentially. I think then, the other thing is just, it's also getting much more sort of accepted or common or encouraged that researchers should be analyzing outcomes across different groups. So to kind of just see empirically if there are effects that are occurring across different kinds of groups. But I also think that different researchers place different emphasis, right? Again, I think I alluded to this in my comments, that people come to research from their own unique set of experiences and backgrounds. So for me, growing up in a rural community and sort of really issues of class being far more prevalent for me and my kind of upbringing, it's something I'm constantly focused on, is region and class. And so I think that that's one reason why we need lots of different kinds of researchers looking at these questions, because they'll look at them from different kinds of angles. So I think a combination of theory, a combination of actually looking at your data through these different lenses, but also what you're ultimately interested in as a researcher.
Okay, and Niru?
Sure, thanks, Dion. I would wholeheartedly agree. And I think another issue that, aside from just the theory, is also what are the policy relevant questions that we can be looking at through the data. And especially if we think about administrative data, one of the big challenges is that usually age and sex and perhaps urban rural geography are amongst the limited numbers of characteristics that are available in these data. So sometimes even our questions are limited just by the existence of which variables in the data sets, which is why then the linkage to surveys that have much more detailed identifying characteristics opens up worlds of opportunities that we didn't have before to look at other kinds of factors. And I agree as well, a lot of it can be driven by our own policy and personal context as well. Coming from New Brunswick, for example, a largely rural, small urban population, our policy questions aren't necessarily the same as those driven in large urban centers. Most of our towns and cities only have one hospital. So looking at, issues of access for us tends to be defined a little bit differently than, well, if you can't go to one hospital, you go to another, which isn't necessarily the same policy relevant context, or where we are, you know, competing for attracting physician and other healthcare professionals. Again, our policy and landscape environment is a bit different. So all of these will frame which is the key characteristic that we want to look at. But the reality is also, I think it was Dion who mentioned it too, a lot of the times sex and gender are just sort of included as a control variable on the right-hand side of a regression model. And a lot of the research that looks a bit more systematically into how well gender is considered in a lot of these research finds there's a big gap between a study saying they're going to control in the method section and then actual gendered interpretation of the results and the implications for policy, healthcare practice, and other actions. So even if there's a lot of emphasis in this panel on sex and gender, I think we still do have a long way to go.
Thanks so much, Niru, and that was, and Dion, I think really coherent answers to a pretty complicated question. Sylvia, I'll ask you to think about starting us off on the next question, which is focused on gender inequalities for transgender and other gender minority individuals. So the premise is that transgender individuals have been considered to be some of the most susceptible to income inequalities. And the specific questions are, can you comment on why these individuals weren't addressed specifically in the presentations? And secondly, when there is an option that allows for other please specify in gender identity, with the description of non-binary as the third gender category. Do you think that transgender individuals are actually adhering to the binary gender categories, or are they choosing the other? So complicated question, but Sylvia, I'll get you to kick us off on that, please.
Sure. Well, I mean, the short answer why my research with the West doesn't address transgender issues is that it can't. The data is collected only in terms of a gender binary, and Statistics Canada allowing us to look at the transgender population is very new. So an older data set like the West, which the last wave of collection was 2005, that information simply isn't there. There are also going to be practical issues going forward unless Statistics Canada make some kind of effort, and I think it's quite difficult to do, to figure out how they would do that, to oversample the transgender population, because in any given data set that is not something like the census, which has a really large sample size, when you're dealing with relatively small population groups, the ability to kind of do a meaningful analysis on that group is going to require some kind of oversampling, because you might end up with 50 people who identify as transgender in your data set if it's a general social survey or something like that, and then it's hard to do any kind of meaningful statistical analysis with it. So that is I think that's going to be a real challenge. And so just adding a more nuanced opportunity for identifying gender in a broader and less binary way isn't necessarily going to actually open up a lot of opportunity for analysis on that specific population with our existing data sets per se. Whether transgender folks are going to be captured in the non-binary data, I think that's actually less of an issue. They may or may not, but what the way that Statistics Canada is now collecting this data would allow you to do is to see where to also see where there is a mismatch between sex assigned at birth and gender identity, which would be another way of identifying transgender individuals. So I think that there is a possibility in how they have created the new means of identifying sex and gender that would allow that population to be identified. The challenge is going to be if there's enough folks who are in that category in the whole rich range of surveys that are collected, where we might want to look at transgender as a meaningful category that organizes experiences and identity, as in labor market and labor market discrimination, whether we're really going to have meaningful data to be able to do that without more of an effort than just allowing for a different way of classifying sex and gender.
Okay, Sylvia, thanks for that. Let's take a look then at another question that's come in, and Niru, I'll ask you to start us out, and maybe Mark, you can follow up. This one also, of course, has to do with data, and it's around better understanding the medium long-term impacts of the pandemic on girls and women. And the question is, should the research be supported by longitudinal data rather than cross-sectional data sets? And specifically, there's a request for comment about whether we should have a return of longitudinal surveys, such as the Survey of Labor and Income Dynamics. So Niru, over to you.
Sure, thanks. That is a wonderful question. And I think, like with any data source, there are strengths and limitations to either type, whether it's cross-sectional versus longitudinal. That's one of the big strengths of administrative data, is that you can have longitudinal follow-up with little loss over time of our particular cohorts, which is one of the bigger challenges of survey-based longitudinal data. By the time we track them over time, first of all, it takes a long time to get that longitudinal information. And then secondly, there's a greater risk of loss to follow-up. And then, of course, we don't know what kind of biases are being introduced in that. And I think given especially how rapidly COVID has transformed all aspects of the way we are currently living and working and studying and learning and doing research, we need data sources that are more flexible, that can be accessed for research use faster than that which a longitudinal survey might be able to afford, just given, the realities of how long it takes to collect longitudinal survey data. Of course, in the longer term, that's a goal that I hope Statistics Canada will continue to pursue, but recognizing that it is also a very intensive and time-consuming process, I think it also opens opportunities for better use of and better interest in the use of administrative data as well to help fill some of those gaps in the meantime.
Okay, thanks so much, Niru. How about you, Mark?
Yes, thank you. A very good question. So just to echo what Niru just mentioned, no doubt that longitudinal surveys that StatsCan have done, greater than the SAY, the Youth and Transition Survey, the longitudinal survey of immigrants, those have provided a lot of good and solid information to users and researchers in policy. Those longitudinal surveys obviously has a major undertaking. And we've been facing, to be honest, in the last few years, a decline of the response rate, which is much harder and harder to have access to keep people on the phone for 45 minutes, 1 hour, and more. So as a result, we had to think about different ways that we can continue to provide this information. As Niru said, I think the key there that StatsCan has put forward his agenda is through the link of administrative data file. In fact, some of the research data centers had the opportunity to, I think there was an initiative called to increase the life of some of our longitudinal surveys. There was something on the longitudinal survey of immigrants that would be able to follow up what's happening to those people that have been in that survey, in 5 or 10 years from now. So this is the key there. However, and also where we know this is that StatsCan, I'm giving an example again, the immigration database, what we call the IMDb, is a really good example as to where for the last 2 years, and thanks to our colleagues from RCC, we've been able to put together a whole list of administrative data file. And then what we do is that we link back this information with census data, with other information that we may have. So we do it the other way around now. We're taking admin data as a source, as a default, and see how we can now add other survey data that could provide more meaningful information. And just one last thing before we go, during the pandemic, as you know, StatsCan has initiated new data initiatives. One of them was using the crowdsourcing, but another one was the web panel surveys that's been quite successful. And we're trying to leverage this idea to see how we could potentially use these new techniques as web panel, because basically through our web panel is like a longitudinal where we'll be asking people to do short survey on every 3 or 4 months for a short period of time. So StatScan is pushing the boundaries on this area. We'd like to see how we're going to be able to achieve higher response rates by doing some new techniques. So I would just stay tuned. I think there's a lot on this one.
Great. So, such interesting answers is that there's, sort of snapshot surveys, there's cross-sectional surveys, there's longitudinal surveys, there's linkages to create connections between surveys and administrative data. So many different options. So many options to get the data. I see many questions still coming in though. So I just, for those of you who are able to stay, that we'll be able to, maybe if we ask the panelists to stick around for another 10 to 15 minutes, we'll just try and get to as many questions as possible during this session. So thanks for all of you who are able to stay with us. One question, and I'll ask Dion to kick it off and maybe Sylvia to follow up. And it's around COVID-19 having an unequal impact on workers. So if you had to pick one type of data or data linkage that would really fill in a gap for us to properly understand the impact of COVID-19 on women, parents, and minorities, what would be your most valuable data or data linkage?
So this is such a great question, because this is the biggest part of my research right now, is actually trying to establish what the effect of COVID was in the labor market on different groups. And I think just following up on the last question is related to sort of the way I would respond to this one, which is that the labor force survey, and in fact, the public use microdata files that are available to people, are actually quite excellent in being able to sort of look at the impact of COVID on different kinds of groups. I think that what would be exceptional is if the labor force survey could be linked to the tax data, and that was actually a little bit more accessible. That would just be ideal. But I will say that for what it gives you, it's actually pretty incredible. And I think that, what's coming out from that for me is that we really, the COVID impacts are disproportionately on the lowest income workers and on youth. And so I think that it's also interesting in the discussion about the gender panel, back to some of the comments in my talk, which is I think that we are going to see that in the long run, and we're starting to see this come out a little bit more now, that it's not as much a disproportionate impact across gender in COVID as it is a class and youth issue.
Okay, and Mark, what do you think about that one? Oh, sorry, I think I've messed up my my speaker. Sylvia, how about you respond to that one?
Sure. So I've been using the labor force survey to sort of extend my work on parents and inequalities around parenting and gender. And so that has been really interesting. And I do agree that particularly our research was showing that in the early months of the pandemic, there was a really disproportionate class impact. So we were looking specifically at gaps that were emerging between mothers and fathers who had been previously employed and their employment as the pandemic was happening, as all these extra, care responsibilities were landing on parents' shoulders as daycares closed, the schools closed, and, as people were also having to juggle working from home or not being able to work from home, right? So in those early months in the pandemic, what we saw was that among less educated parents, there was a huge gender gap growing, particularly because those less educated mothers were more likely to be in jobs where they couldn't be working from home, right? Where they had to give up their job if they suddenly had no one to take care of their kids, and it was the mothers more than fathers who were losing their jobs. I've just looked at the more recent data, and I'm going to wait for one more month, and then I've been sort of invited to, along with my colleague Yue Chen, to submit a paper on the more recent data. And actually some of those education gaps are now closing. So that the more educated mothers over the course of the summer, as there was no summer camps and so forth, and the school was starting, they've had more of a growth in the gap between mothers and fathers. And I think that speaks to how sustainable that kind of working from home while having little kids underfoot has actually been for parents. So I think that one of the interesting linkages for me, and I've just been using the public use data on this, not the RDC data, would be thinking about how could we possibly link that labor force survey data, because I do think that's the best data for capturing that sort of month-to-month change, which is really important for the pandemic, to schooling information. Who's got kids in school? Where are the kids going back to school or not going back to school. I mean, it might be a smaller amount, but it's, I mean, anecdotally, even when the schools reopen, not everybody is sending their kids back to school. Who's not sending their kids back to school? Either because it can't, my kid can't go back to school because my partner is immune compromised, or because, you know, they have a little more flexibility to be able to do that, but maybe that's really going to be impacting their, you know, their employment more. So I think actually it wouldn't be something that in normal times I would think would be a useful or a first, you know, a first thought in terms of linkages. But in terms of some of those gender differences that we're seeing in employment around caregiving specifically, knowing who's got kids and who's actually have their kids back in school versus schooling remotely, if we can identify that with administrative data, that would be quite useful to understand some of those dynamics in the pandemic.
Mm-hmm. So a couple of great ideas for connecting data. So let's go back for a couple more questions. Dion, I'll ask you this one. Can we access the gender equity information that's related to Indigenous populations in Canada?
So that's a really great question. I mean, the data that I have used in my research studying rural and remote Indigenous communities has been data I've collected on my own as part of other research projects. So I haven't done a lot of digging into the kind of data that's available from sort of the RDCs and StatsCan on Indigenous populations. I think there's a lot of problems with data that's been collected by governments, mainly because just sort of issues with on-reserve data collection and that kind of thing. And so I think that I'm just always a little bit more skeptical of the data sets there, but I'm sure that Statistics Canada has been doing a lot of great work in this area. Mark might be a better person to answer that kind of thing, but I have not used the kind of data that's available within the RDCs on this issue.
Okay, Mark, why don't we let you weigh in on whether there's good information on that topic?
Yeah, so that's a good question. So no doubt about it, the data on Indigenous population is probably one of the areas that is probably one of the major gaps that StatsCan probably have, other than census data. Obviously, census has a lot of information, but doesn't have the in-depth information necessary for gender equality. The main data sources that researchers will be doing for doing gender equality data in-depth analysis will be the Aboriginal People Survey that was done in 2017, that is now available to the Research Data Center. But as it was pointed out, many of gender equality issues that may be that we have to think about is our population living on reserve, which is a major data gap for StatsCan. There is a StatsCan is working very hard and established good. We're working in partnerships with other organizations. We know that organizations such as FNIGC is also doing a lot of great work on reserves as well. So try to work with them to see how in the future of data collections, how we can all work together. One thing I should probably mention is the administrative data is also another venue. We've been working with our colleagues from Indigenous Services Canada to see what are the informations that, administratively speaking, could be available. But Kathleen, just to go back, it's a good question. I don't have an answer for that, but it's something that needs to, I think that needs to improve.
Okay, and then Mark, I have a couple more questions for you, and they're both around access to data. So the first is around the new ethnocultural data that's part of the labor force survey. When is the detailed data going to be ready for researchers, and can it be faster? So that's the only speed people like. And then the second question is, how can you expedite the process for access to data for students?
That's two good questions, and I'll be able to answer all of them. As you know, the labor force survey, those data is been now collected since July. I unfortunately don't have an answer to when those new variables for the ethnoculture will be available, but what we would do is that maybe we can work with the organizer. I can reach out the managers responsible for the labor force survey to get that exact answer to when they'll be available, accessible. I know that people can have accessible through customized tables at the time being, because it's just a very new questions that has been added. Given the limitations, it's also going to be challenging to get the details of geography details of that variable. So researchers may have to wait a few months by combining informations. The second question was about how to expedite the access to students. I don't know if there's anyone on the line or on the audience from the CRDCN to talk about more about the access. So I know that given the pandemic, there has been some restrictions to have access to the research at the center. There has been some research that has been reopened across the countries, and they, meeting the social distancing rules. To accelerate, I think what we probably will suggest for those individuals that have questions specifically for the research at the center is to reach out to specific research centers about these questions, and then they'll be able to answer to them to how access for students who will be resumed, or if it's not accessible right now, how they will be resumed and when, because every research center has its own rules and regulations for access during the pandemic, and it varies quite a lot, as you can imagine, from the country, depending on which zone you're also red or not. So.
Okay, thank you, Mark. I think we're.
Sylvia, I think, had something to add.
Oh, go ahead, please.
Oh, just a little tip there for students, because this is, access to the RDCs is a huge problem everywhere. I'm in charge of the UBC RDC and also very connected to all the BC ones. And it depends where you are in the country, right? You might only have, real possible access to one RDC, but there are some places, like if you live in the lower mainland, for example, of British Columbia, where you might be able to access more than one RDC, and it's useful for students to think beyond their individual institution. So for example, UBC, we opened a little bit earlier than SFU did, so it would be certainly possible for SFU students to come and work at the UBC RDC until the SFU RDC opened. Conversely, we have more capacity constraints at UBC, fewer workstations, more people trying to use them at UBC than at SFU. With the SFU center opening, it might be useful for some UBC students to think about, if it's not too far a commute, to go to SFU instead. And I imagine that there are other places like in Ontario and Toronto where you might think strategically about U of T, York University, thinking about where there's actually a little bit more space or a little bit more capacity, or where some RDCs have opened earlier than others. It's just a bit of a workaround, but it's worth thinking about, given that we're all dealing with these, very difficult capacity issues in order to maintain social distancing in the RDC, where even though you can have access, the time you have, the flexibility you have is just going to be less. Without a huge infusion of money to make more space, to build more space for the RDCs, it's going to be a constraint for the foreseeable future.
Okay, we have tried our very best to get through all of the questions, but I think there's a few that we won't be able to manage. So I'm very sorry about that. And we'll, if there's anything we can do to follow up with them, we'll try our very best. But thank you all so much for joining us today. Sylvie, Dion, Nehru, and Mark, I think, have really given us both a broad overview of where things are at on gender analysis, but also where things are going and the data that's needed to support that. And also some good thinking about how the CRDCN can play a key piece in that. So thanks to all of the panelists. It's been fabulous. And in closing, I'd just like to thank you in the audience for being part of our session today, and remind you that tomorrow at 1 p.m., there's a panel on ethnic and racial issues, and I know I'm signed up for that and looking forward to it. I hope you'll join me there. Thank you, everyone, and goodbye.